And I think one of the best things, and this is going to sound like the weirdest thing coming from a doctor, you have to become your best own physician. Pain is a protective sensation. If you lose that protective sensation, then that's when you go on to amputations. Does that make sense? So when they come in with a hole in their sole, which is an ulcer, I often remind them to heal the hole in your sole, the foot. You got to heal the hole in your sole.
Hello, this is AARP Georgia's Red Clay Talks podcast. I'm Adrian Bell, and I am joined with my co-host,
Michael H. Cole.
And we try to empower you to make sure that your money, health, and happiness lives as long as you do. Speaking of health and happiness, we are joined today by Dr. Suzette Clements, who is a podiatrist.
Thank you. Thank you for having me.
Thanks for coming and joining us.
Yeah, thank you.
Now, give us a little bit about your background. Tell us, who you are.
Okay, so I am Dr. Suzette Clements, as Adrian said. Thank you so much again.
Yeah.
I have been in private practice in Decatur, Georgia since 2002. So I'm a little older now, more mature,
Just
more seasoned. So AARP appropriate.
She's 29 now.
Right? So I tell my patients that it's kind of weird to say that I've been practicing for 23 years when I'm just 22. But so my specialty is anything foot and ankle. Okay. So in Georgia, our scope of practice is bone it's called the tibial tuberosity, which is the bone right at the knee in the front, and soft tissue to the hip. Yeah, so our scope is actually pretty significant, but I treat anything of the relating to the foot and ankle. Yeah, all age groups as well.
Okay.
So in other words, she takes care of your soul.
Of your soul?
Yes. So
She's heard that before.
Can I give you a better, can I highlight that a little
Sure.
bit? So when patients come in, because I treat a high diabetic population as well. So when they come in with a hole in their sole, which is an ulcer, I often remind them to heal the hole in your sole, the foot. You got to heal the hole in your sole. Yeah. So that's where you look at the whole person. A lot of times we don't think of ourselves as, we're a whole being. You're not just a body. You're not a mind. You're not a spirit. You're all of them. So in order to treat you right, I have to treat you all the way. So we have to look at the foot, but we have to look at the whole person to make sure that they're doing well.
Now, tell me a little bit more about that. How do you diagnose? Like if I'm coming in and you spoke of like diabetes.
Yes.
If I'm coming in and saying, okay, my doctor says my A1C is high,
right,
but I'm having problems with my ankles or my balance,
right?
How are you diagnosing them so that you're taking care of that whole soul as you spoke of?
So thank you. That's an excellent question. So first of all, you have to, when we do an evaluation, we're looking at everything. We're looking at gait, which is how someone's walking, right? In addition to looking at gait, we're also looking at the arterial system, meaning the blood supply. Vein is one thing. So when the heart pumps, the blood that goes away from the heart that's the arterial blood supply, right? Now, the vein that goes back to the heart is the venous. We're talking more about arterial supply. So I evaluate for that. That's called PAD, peripheral arterial disease, because if you don't have oxygen, nothing will heal. So that's the first thing. And lack of oxygen is what causes gangrene. And gangrene is what goes on to amputation. So we evaluate the arterial system. We want to make sure there's adequate blood supply for it to heal. We also look at the bony structure, because if there's a bony structure, such as a bunion or a hammer toe, that bony structure will cause pressure. Pressure over the bony prominence is going to lead to an ulcer, which is a break in the skin. So we have to do that, what we call a biomechanical exam, right? So in addition to looking at the blood supply, doing the biomechanical evaluation for hammer toes, bunions, or anything else, flattening of the arch, we also look at the nervous system. Very important. That's often overlooked. So when I'm talking about the nervous system, I'm talking about, it's called peripheral neuropathy. Peripheral having to do with the peripheries, the hands, the feet. So if you have peripheral neuropathy, you may not have your protective pain sensation, pain or pressure sensation. So imagine now, and this is why a lot of diabetics are criticized unjustly, because they will have a nerve damage and do regular walking in an ill-fitted shoe and end up with an ulcer, where a person with what we call a sensate foot, meaning you can feel your foot or your foot can give you feedback, is going to be able to say, oh, my foot is killing me, I'm going to take my shoe off. But you don't have that feedback from the foot. So when you don't have the feedback of pain or pressure, you continue doing repetitive micro trauma. It could just be walking because, yes, your doctor said your A1C is elevated. Everybody's recommending you go and walk. But guess what? You don't have the ability to walk because you don't have that protective sensation. Does that make sense?
Yes.
Yeah. So again, blood supply, bone structure, making sure that the sensation is there. And lastly, we look at the skin, because if the skin is not good, if the skin is too dry, too moist, first of all, the skin's area of protection, it literally blocks out or keeps the wrong things out and the right things in. If the skin is broken, then fungus gets in, bacteria gets in, and that's how infection starts. So that's why we make such a big deal. And I won't go into treatment yet, but one of the biggest things we tell patients is don't put oils or lotions between the toes. Why? Because it becomes moist, fungus bacteria gets in, and it creates an abscess, which is a pocket of pus. And a lot of times they may not feel pain. A diabetic with nerve damage may not feel pain. And how do I know this? Because I will literally have my scalpel. It's called debridement when you're removing the tissue that's not good, right? When I'm debriding in the office, we're talking about the kids. I've got my scalpel and I'm just chipping away at that foot. And we're just having a conversation like, there's nothing going on. And that's without anesthesia. So a diabetic with nerve damage has their own built-in anesthesia. It's not really good. We don't want that. You want to be able to feel pain. Pain is actually a protective sensation. Listen to that. Pain is a protective sensation. If you lose that protective sensation, then that's when you go on to amputations. Does that make sense?
So if you lose that sensation, this may be a ridiculous question. How do I know I've lost something that I didn't know I lost?
That is the key. Most people don't realize they do. Because have you ever heard of the process of how you boil a frog?
Oh, yeah.
It's the same thing. Slowly. That's why it's so important that every single calendar year, there is a proper foot exam done by a doctor who knows how to do it.
Wow.
If I say nothing else, I can go home at that point, right?
All right, it was great talking to you.
Yeah, but the key is proactiveness versus reactiveness. And I say that because within 3 to 5 years of one amputation, a second one is needed.
Oh, wow.
But here's the worst part. Once that first one is gone, then it exponentially increases the risk of a second and a third and a fourth. So a patient may say, oh, I came in, I saw the doctor, I just had this little callus underneath the bottom. When I was done, I had a big old hole, and then they had to remove a toe because I didn't have enough blood supply. Here's the reason why that progress happens. If you don't have adequate blood supply, which we talked about before, the arterial flow, then anything you cut at that point will not heal.
Wow.
So you have to cut to the level of adequate blood supply. Sometimes it's going to be below the knee. Sometimes it's above the knee. Sometimes it's disarticulation at the hip. However, if we can prevent the first amputation, that is really the key.
Wow.
I'm sitting here like, huh?
I know.
Because that's a lot. I've only gone to the podiatrist because when I was in police academy, I had fasciitis.
Oh, plantar fasciitis?
Fasciitis,
yes.
And now that was painful.
Oh,
It was
yeah.
a little spot in my heel. Now, I thought it was a heel spur, but you're saying they're two different things.
So let me explain what happens. So when we do an x-ray, we will find sometimes a little bone spur. Wherever the bone spur is, will define where it is. So you can have a heel spur at the back of the heel, underneath the bottom. You can have a bone spur anywhere. Now, if you do an x-ray, because I do tons of x-ray in the office, if I do an x-ray and I find a bone spur and you have no pain, is it the bone spur that's causing the pain? I'm just saying, think about it. Yeah. So I no longer treat the bone spur 99.99% of the time. I treat the soft tissue that's inflamed. The soft tissue that's inflamed is called plantar fasciitis. Itis is inflammation of, and when you have an inflammation of the band of tissue underneath the bottom of the foot, it's called the plantar fascia, that band, which is extension of the Achilles tendon. So as the Achilles tendon comes down, it sends fibers that becomes the plantar fascia. At the insertion where it inserts into the heel, that's that sweet spot. It's a sharp, stabbing, knife-like.
It's awful.
Oh,
It is.
First step in the morning is a wicked pain.
I almost thought I was going to fall over.
Yeah, you know why you fall? Because you shift your gait.
Yes.
You turn the foot out because you're trying to avoid
Right.
the area. So untreated plantar fasciitis becomes ankle sprains. Because you're twisting
you're
out.
twisting it, yeah.
Yes,
And
yes,
that was
yes.
so painful. I couldn't twist up because we used to have to run 2 miles almost every morning.
Oh, yeah. Oh, yeah.
Because we were training.
Right.
And now, but it was simple treatment. Well, simple to the extent of
Right.
dealing with a needle about this long getting stuck in your
We won't
heel.
tell everybody how long the needle is. It's long enough, but
Yeah. And the doctor laughed at me. Because, I was kind of muscular at the time. I'm,
Right.
sitting on the table. He's go, I literally jumped.
Okay, I'm
He
like
said,
really
so-
excited now.
Bigger they are, the
I
harder
woke
they
up with
fall.
plantar
Bang.
fasciitis today.
I know.
Yeah. Oh, that's
And
what
so
you have now?
Yeah, and
Yes,
she's my
yes.
podiatrist.
Yes,
and she's
yes.
already said, well, you need to come in. And now I'm just going,
The needle's only about that long.
It's a
It's about-
pediatric needle. Just happens to be
for a horse.
It just happens to be a little longer,
It's
but
about as long as that little stem right there.
but that's
It'll
just
be okay.
one of the treatments. Though there, for people with true phobia of needles, there are other things that can be done. But the point
Alcohol.
is, well, we use alcohol to wipe off before we do the
No,
shot.
you
No, I'm
suck
talking
it
about
in.
that's
drinking
different.
alcohol. Oh my
Yeah,
God.
but it can't, and that is another one that's preventable.
How so?
Because think of routine maintenance on a car as self-care in a human being.
Okay.
Now, when you have proper self-care, you are proactively taking care of the body, right? When you have proper routine maintenance, you don't wait for the tire to get flat. You don't wait for the oil to run out. You don't wait for the check engine light to come on.
Right.
well, some people.
Typically,
My wife.
he did not mean
No, I
that.
didn't.
Not at all.
They don't even know who she is.
So the goal is proactive self-care.
Right.
So what happens now, if you had the proper arch support, if you had the proper shoe, if you had the proper conditioning prior to doing what you were doing, it typically does not come on. And yeah.
Wow.
Well, and in defense of my wife, this literally happened 3 days ago. The check engine light came on.
Oh.
And I was going to have to pick up her car and take it to somebody to have it checked because it was probably the temperature.
Right.
She did what you were saying. She, on her own,
Yes.
went to a place where she manually added air to all the tires herself, and the check engine light went off.
I'm just
it-
saying. It
She
makes
was great.
sense.
It was awesome.
Yes.
Just
Yeah.
maintenance.
But that's the maintenance. She saw the
Yes.
warning. She immediately took care of it.
Right. So what I'm saying, it's called preventative maintenance. Now you can have breakdown maintenance. I don't want that though.
Right.
I mean, it's good for business. Do not get me wrong. But I prefer to have people where I overeducate them. And that's one of the things I love as well, because when you overeducate people, they do exceptionally well. And here's the gift of that. Not only do I get them better faster, but they refer tons of other patients. So you don't have to recycle patients, that nonsense. So what you do is you get a patient to align with their natural healing. So that's really my job. As a surgeon, I take people who are out of order, I put them back in order, and that's called redemption. Well, you understand?
I do.
You know. Yeah. So when we help people get back in order, they're already designed to heal. So I look like a big hero, but I literally just realign them.
Okay.
Does that make sense?
Yeah.
Yeah.
You are a big hero.
I'll take
No,
it.
the one thing that I would love for you to share,
Yes.
because I think this plays into it, is because I've been to her office a number of times, and she has these sayings plaqued all over every single room.
I know.
Where the patients are, and you
Yes.
can't help it. I'm not looking at like a diagram on my foot. I'm looking at all these. So what is with, I mean, I know,
Yeah,
but for the
yes,
sake
yes,
of
yes.
people, what do you do? What are this kind of sayings that are there?
So it's based on Dr. Emile Coué. He was a French physician, and he talked about autosuggestion, right? So his saying is, every day in every way, I'm getting better and better. People would come to his clinic and they literally would come in a wheelchair and they'd walk out. So the premise of autosuggestion is that your body listens to your spoken word faster than anything. Now, we have been programmed, all of us, to think that there's power in the white coat. I happen to have a long white coat as a surgeon, so I use my power as the white coat, right? So before you even physically see me, you have already started releasing endorphins, because endorphins are nature's morphine already in your body. So when people start looking at my walls and they're like, oh, wow, oh, wow, I didn't know that. They already start feeling good. So I'm really doing that to prepare the soil for when I come in and say, hey, this is what's needed. They're telling me already, hey, doc, look at that. I didn't even know that, but that registers with me. You see what I'm saying? So the Bible says that the people perish because of lack of knowledge. And here's the deal. We have a lot of educated fools. So you can still be knowledgeable, but until you apply the knowledge, it's just potential energy. So what I do is I educate my patients using my walls, because my claim to fame is that I deliver hope. So I'm a great hope dealer.
Yes.
Right? Because I'm in South DeKalb. So what else am I going to do?
Yeah.
I'm going to deliver hope. You catch that?
Yes,
Good job. I need a little laughing with that, right? So I'm
in a
hope.
hopeless environment, a little bit of hope is a lot.
Absolutely.
Exactly. So when I can deliver hope, my job is not so much to tell the patient what to do. My job is to align them with what they need to do for themselves. So I empower people to do what is necessary to get them back in alignment. And when I do that, they walk out and I'm like, and the funny thing is, even before I give the shot, if I'm doing a shot, they will already say, wow, I feel like, 10, 15, 20% better. And that's because of the endorphins that are flowing in the body.
Oh, wow.
Plus, I'm very jovial. I'll give a couple jokes and, my little Jamaican accent come out.
She's very funny.
So she's preparing you for the shot you're going to get.
Oh, yeah. Get him laughing and then.
I know, right?
Oops, did I do that?
Did I do that?
No, you talked about prevention.
Yes, yes.
Now, I guess the two types of, they used to call it flat-footedness. I don't know.
Correct, yes.
I don't think mine is the worst, but I used to wear inserts even when I was running and came up with the fasciitis. What kind of inserts are usually best for maybe a person that doesn't have a whole lot of arch just naturally?
So first of all, we'll do an x-ray to see where, it's called the calcaneal inclination, to see where the big bone of the heel, how far down it goes, right? And when you do the gait exam, you can tell it's called too many toes, because the flatter you are, the more the toes go out and you're rolling it. We call it slew foot back in the day, but we're not going to call you that now because somebody's going to talk about it, right? But anyway, so that's what's happening. So the excessive rolling in of the foot is called pronation. So when you're pronating, you're rolling in. Think about what's happening. If the foundation is flattening, do you not realize that the knee is going to flatten as well? So the knee is going to roll in. So most of the time, it's going to be pain on the inside of the knee, medial knee pain, although it could be lateral. Most of the time, it's going to be medial. Then it's going to be lower back and hip, because you're connected. So when the foundation is off, it throws everything in the superstructure off. People don't think about that. Wow. So where does the orthotic, which is the arch support, where does that come in? It begins the rebalancing. So if the tire is flat, what do you got to do? Balance, align, and rotate. If your tire is flat, what do you got to do? Balance, align, and rotate. So the best orthotic is a custom-made orthotic for you. Not everybody needs a custom. So the best thing to do is have a proper evaluation. Shoes, equally important, because if the shoe is very narrow, very rigid, the shoe can break you in before you break the shoe in. So anatomy of the shoe is important as well. If you look at your shoe and look on the outside border, if it looks like somebody grabbed it and grated it on the concrete, you're a pronator. So that means that you're off balance already. So when you're off balance, it can throw the spacing of all the joints in the superstructure off. Wow. So what does that mean? You must keep your foundation foundationally supported. If the foundation is off, then everything in the superstructure starts to become off balance. And that's where pain comes in. Pain is your friend. Pain is literally like the check engine light saying, hello, I need your attention. I need your attention. And if you don't listen, so it'll, for instance, one of the things I treat is what's called a neuroma, right? Which is a pinched nerve in the forefoot. Most people do not listen to the first signal, which is numbness. So then there's tingling, then there's burning, then there's pain. But most people come in at the pain level because we've somehow associated, well, I finally got to go to the doctor now because I'm in pain. But what about those other symptoms that were there that you bypassed that literally could have helped you get better faster? So the body we're very intelligently made. Every single organ has a feedback to tell us something's out of order. If you have an infection, you're going to have nausea, vomiting, chills, fever. You may even have it's called a generalized malaise where you just don't feel good. Right. Most people may, especially in the diabetic population, they may not have the nausea, vomiting, chills, fever because they're not even able to, we call it mount a response to the infection, right? They don't even know they're sick, but they may have a weird sensation where they don't feel like eating anything. And that's usually the indicator that they have an infection in their foot and don't even know it. Because remember, they can't feel it.
Wow.
You know, I don't even think I shared this with you, but when I was doing the PT, because of my balance and the weight loss and did I have Parkinson's or not and blah, 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 blah. One of the DPT said, take your shoes off. And I did. She says, walk across over here. She said, have you ever had problems with your feet? And I went, yeah. And she said, from very young? And I went, yeah. How do you? She said, what was happening very young? And I was born with severe pigeon-toed.
Yeah.
And she said, and what did they do? Well, they didn't do anything. My mom had to take my feet and do this twisting action.
Yes.
And she went, okay, that's way outdated. And she said, what happened after that? And I wore corrective shoes for a couple of years. I hated them. Everyone wore the Keds.
I know.
I wore these leather.
You had to.
And my brother always made fun of me because of it. And she said, that didn't correct it. And she says, you have lived with pigeon toes without the right width shoe your entire life.
Yeah, so you've
She said, it's dogpiling now. And so she was one. I mean, like I said, you're sounding like my podiatrist. She said, well, I'm not a podiatrist. You need to have your feet looked at.
Absolutely, yeah.
And I just never really thought that would be. But my toes were not splaying; they were folding in on each other.
Correct.
She said that's a clear indication of a very narrow toe box. Your feet are meant
to have spacing,
right, and that's affecting your balance. And I found that my left leg, which to this day is still my weakest leg, and my right leg, and I'm a southpaw, is, oh, that's right, it's associated.
Yeah.
I write and draw and flow and all that stuff like this. But anyway, so it's just been a weird journey, especially this year.
Yeah.
So I'm going to go see her, and she's going to stick one of those needles in me.
But don't
Can we
worry.
do
It's going to help.
Can we film that?
Absolutely.
Yeah.
Yeah.
I think it'll be good B-roll.
Make
long as
sure
we
the
don't show any
microphone can
faces.
pick up the yell.
Yeah. Oh, Lord. No,
show
she stuck
you
me before, and I was fine.
Yeah,
It hurt a little bit.
See,
Don't move.
I'm learning something though, because being athletic, we think that a lot of times we're having knee problems, and it's actually a little bit deeper than that. But when you go to the doctor or you go to an orthopedic, they're not saying oftentimes check your feet.
Because we often, and I hate to say it, do not look for root causes. We're busy.
Okay.
Most of the time I'm like, okay, but depending on the specialist, think about it. I'm a specialist, right? We're going to diagnose you based on what fits into our category that you fall into. But who looks at the whole person?
Who does?
That's what I'm saying.
There used to be doctors who were specialized in like internal medicine or something like that, but I don't
was
see
in the
that.
60s.
No, there's still excellent internal medicine, right? But the volume that has to be done now there's no way you can look at the whole person. So the thing is, I choose to do it because that's just what makes sense to me because I can't treat you halfway, and nobody talks about the emotional aspect of it either, because with that plantar fasciitis, it makes you feel old.
Yeah, it sure does.
It plays with your mind.
It does.
You know what I'm saying? You walk in, all of a sudden you're doing this. You're like, oh my God, they're looking at me, and you feel self-conscious. It can throw you into depression. It can create anxiety. So there's a whole component of healing that people don't realize. So I literally say the following to most people when they come in. If your pain level is 7 to 10 out of 10, I'm going to say, get your mind right. And I'm going to say, get your mind right. Because once I help you get your mind right, then mind over matter, the body starts to come in alignment. But if the mind is off, I can't really do anything. So in order to get the mind right, so one of the sayings I have on my wall is, I've got tons of them. I don't even know where to start. Yeah. It's to heal your body, you must heal your mind. To heal your mind, you must heal your spirit. To heal your spirit, you must look for the good in all things. And if you're spiritually inclined, you look for the God in all things. And it's important because a lot of times you don't think that your 10 out of 10 heel pain could actually be stopping you from getting a heart attack or a stroke.
Oh, wow.
I'm just saying. You're on that hedonic treadmill, right? Your doctor just said, hey, your A1C is 10. You got to walk that baby off before you end up with a heart attack or a stroke. So what do? Start walking around the block. You're just going. But you never realize that pain, that indicator, caused me to slow you down enough to cause your blood pressure to normalize, to cause your blood sugar to start coming down, to actually help you walk away from a bigger problem.
Interesting.
Okay, so I'm seeing you Friday, right?
You're coming in tomorrow. No,
but
probably Friday.
Is your mind right?
Yeah, it's right.
That might be debatable, but now,
oh my God.
We both mentioned two different childhood things. I was sleep-footed. Well, now it's pronaceous?
Pronation, excessive pronation,
I got another adjective. And you were pigeon-toed.
Yeah.
Now, a lot of times as parents, we see little things, even like we call kids bow legs.
Right,
Yeah.
right.
We see a lot of these things in our youth, and we don't correct it.
Correct, because we're not taught to correct.
Right.
And I hate to say this because even in the pediatric world, so a lot of things they would say, oh, they're going to outgrow it.
Right.
They don't. They overcompensate for it. You see what I'm saying? So whether it's in-toe gait, which is the pigeon toe, or what you needed was actually serial casting. That's what should have been done. Serial casting actually takes the deformity and it literally straightens it out. And the reason why you have to have it early enough is because once everything solidifies,
it ain't moving. You're breaking it.
Yes. So you have to do it as quick as possible. And it usually happens, if it's a multiple birth thing where the interuterine space is very small. So there's a pathology of why, there's an etiology, meaning the cause of what caused it. So we expect it in a tight uterine space. But all of these things, properly diagnosed, can be treated successfully.
And they're younger age, so that when they get to be 4 days older than dirt, like Mike. No, I'm just kidding. No, but it does catch up. We're only a year apart.
We still love you.
But I have to. He's my target practice friend. But we both see things as we get older. It bothers you. And the doctors just always told me, oh, you got a little water on your knee. Just make sure you keep the muscles and the tendons around your knee.
Right.
Okay.
Right.
But I never knew that being slew-footed could, and it affects the way you run as well.
It does.
Because I swing my left leg.
Correct.
I guess trying to compensate.
You're overcompensating actually with that. Yeah.
And it would show on the wear on a shoe, right?
Oh, it will.
Oh, yeah.
Oh, yeah. That
I used to put heel taps on my shoes.
Yes. And that's the reason for that.
Yeah.
So the heel tap is like the balancing. Again, balance, align, and rotate.
Yeah.
It makes sense. As the young folks say, make it make sense.
Right.
You know? And I think one of the best things, and this is going to sound like the weirdest thing coming from a doctor, you have to become your best own physician. I'm not saying you do not go to the doctor. That would be insane. Get yourself evaluated. Just like you get an annual physical, you should, like whatever you do to your car, well, hopefully you're doing it proactively, right? You want to do to yourself. And I will say, you know who comes into my chair the most? people who are out of order, meaning that they're
in
not taking
pain
care of
or something.
themselves. Yeah. But guess why?
Because they hadn't done the preventive maintenance or whatever.
But why though? You got to get to the why.
What's causing them to not do the preventive?
Yes, why?
Lack of education. They lack of knowledge? No?
That's part of it, but come on again. Come on. You know it. I know you know it.
Lack of, okay. Fear?
I'm going to sit this one out.
It's not fear. Keep
Okay.
going. Keep going.
All right.
What would cause you to not take care of
Lack
stuff?
of vision.
No, that's true too.
Or just time.
'cause
I
they
mean,
go perish.
making time or prioritizing, putting
Close,
it off.
Close.
Let's see. What are the reasons?
What are
might I
you
have?
doing as if you care for other
Overcompensating or
people?
whatever?
What do you?
You're caring for somebody else. You're putting everybody else first and
Yes.
yourself last.
Yes.
Okay.
The people who are in my chair are because of lack of self-care,
Gotcha.
which is routine maintenance.
Right.
Wow.
I'm just
Okay.
saying. If you're a busy dad, you're running, you got to get from, football to baseball to ballet or mom.
You don't have time for yourself.
You don't make time for yourself.
And now being November, and we're highlighting that with November being National Family Caregivers Month, we got a lot of people in that sandwich generation now,
Yes.
where they're taking care of a parent and a child.
Correct.
So
Yeah, so-
that health care and maintenance is even more important.
Yes, but the key though is in order to help others, we know this. The airline industry tells us this all the time. In the event of an emergency, you must put your own oxygen on first. Now, it sounds a little selfish when you hear it, but can you give from a broken or an empty cup?
Right.
You
You
can't.
cannot.
Right.
So I literally give people permission to take care of themselves first. And it's vital that you literally fill yourself to overflow. That's a spiritual principle as well. So I practice what I preach. I do not come out of my office until I am at a state of overflow, and I give from my overflow. Because if you don't, at the end of treatment, you're going to feel broken. All your energies are going to be on me. And I'm like, oh my God, Michael said the kids are not acting right. And this, that, and the other. Because yes, you will take on the burdens of the people in your environment. Imagine if I have 32 people and at the end of the day, I took on all their burdens. I'm like, Adrian said this and that. And no. I use intelligence. I call it spiritual intelligence, right? I use that to help me discern what is happening to you so I can help you heal you. Because when I'm in your presence, I'm going to feel you and I'm going to know what's going on, right? That's part of healing.
Absolutely.
But imagine if I feel your sadness and think it's mine.
Right.
Right. So the key is to be wise and feel the patient, listen to them, hear their story. This is all under 15 minutes. I'm doing this, by the way. And it's, you can do it. After you've been doing it for a while, I'm at a level of unconscious competence with this right now, right? So when you're able to do that, then patients literally are like, okay, that makes sense. For instance, somebody comes in with an ankle fracture, right? And I said, what was going on in the narrative in your head prior to this fracture? And before they answered, I said, you were asking for a break. What is a break? A fracture is a break.
Right.
So when subconsciously you're asking for a break, guess what happens?
You break.
You get a break.
But it's not the kind you're asking for.
It's not that, because you got to be specific when you ask for stuff, right?
Right.
You know that. So what happens now, I'm going to say, okay, it's going to take 6 to 8 weeks for that fracture to heal. So what am I going to have to do? I'm going to say, I'm going to need you to sit your butt down so you can get to healing. Does that make sense?
It does.
Yeah. So we have to be
does.
very intentional, because I think they say it's like 90% of what's running us is our subconscious mind.
Right.
So if you're not conscious of what's running on that hard drive, you just keep manifesting stuff over and over. And you're like, but my thing is, again, about the blame thing, I don't allow people to blame. You can't blame your wife in my office. You have to take ownership of whatever is happening.
Right.
You can't blame the children. You got to take ownership. Same thing with diabetes. I allow them to take ownership. Now, here's the big deal about taking ownership of what's happening in your body. If your lifestyle produced it, then your lifestyle takes it away.
Wow.
Right there. I'm done.
Yeah.
Y'all pass me something to drink. I'm done. Right there.
So to button it up,
Yeah.
I think we were having a conversation before this started, because I was feeling, because of the issues that I've been dealing with physically, I was going online.
Oh, not Dr. Google.
Not Dr. Google. It's I don't know if it's AI or something.
ChatGPT or something like that.
It's chat, but it was to where you type in a very and I learned the more specific with the choice of words I use, I was able to discover how I'm reacting to medication. If there is a physical pain, like I put in the pain, and I guess what it came up, plantar fasciitis.
Fasciitis, yeah.
I wasn't sure. I was thinking this is Parkinson's related.
Right.
Wow.
And that's where my mind needed to look up more information to get it in the right place. It sounds like from what you're saying.
Yes.
And then I can actually attack it.
So it's the specificity. Yeah. So if you understand it, my assistants will go in and they'll do, it's called the NL DOCAT, right? They do the basic before I come in and I do the true physical. And every single time I go in, I get to the point in less than 5 seconds where they will say, but they never, and I'm like, yeah, you just have to know how to hone in on that. So when you understand the degree of specificity of your questions is powerful. So for instance, red hot, swollen, painful, bed sheets hurt, classic presentation of gout.
Right.
Classic.
And I've had gout.
The pain. Oh, he keeps me busy. Thank you, Michael.
Body's falling apart.
Yeah.
So you're giving us some good information because not all of our listeners or viewers are in the Metro Atlanta area near your office.
Right.
So you're giving us some good information so that we can take it to our respective doctors, whether we're in Athens, Georgia, Gainesville, wherever we are throughout the state, or even throughout the nation, so that we'll know exactly what to ask. And, and that's valuable.
And the more specific your questions, the better your outcome.
Can't say it any better than that.
Yes, but it just makes sense.
It does.
Absolutely.
You know, if you're an architect, do you want an architect that you walk in and they're like, or surgeon, you walk into your surgeon and you say, hey, doc, what do you think about this? And the surgeon says, well, yeah. They pull a Larry Davis. Well, we can, no. You want someone that's going to say, hey, there's a 99.9% predictability. Da, 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 da. They go through the facts. That's what you want. But I hate to say this, but I'm going to say it anyway.
Just make it plain.
We are going to treat you the level of your interest in yourself. We're going to turn that back around on you.
Wow.
So if you come in and you're on your phone and I'm in your presence and you're still doing this, and I'm like, okay.
You don't care about you, so why should I?
Period.
Okay, if you want to, you're going to upset the audio guy. I think you need to drop the mic.
All of that, and then plus you got to deal with insurance and what they will or will not cover.
Exactly.
Oh my gosh.
Yes.
This is awesome.
We could go on and on and on, but I'm going to have to wrap us up here. Yeah, we can do part 2.
Got more.
I would encourage you all to follow us on social media at AARP Georgia. And thanks so much for joining us. We've been joined today by Dr. Suzette Clements. And this has been the Georgia Red Clay Talks podcast. I'm Adrian Bell.
And I'm Michael H. Cole.
Thanks so much for joining us. See you soon.
You were great.
Hey, that was good.
Thank you. Hey, Dr. Clements, I want to remind you that a lot of the diseases we treat are caused by our lifestyles. And the best part about lifestyle diseases, if your lifestyle brought it to you, your lifestyle can take it away. So a lot of times type 2 diabetes is brought on by lifestyle. There are other things that can bring it on as well, like chronic steroid use or things of that nature. But I'm talking about if you're sedentary, if you're eating a poor nutritional diet, that can bring on type 2 diabetes. A lot of times high blood pressure can also be lifestyle. I think it's 1% that's truly essential hypertension, and that's a genetic thing. But again, we're talking about 1%. That's not a lot of people. So what your take home is, what do you have that you must do to reverse these problems? So it puts the power in your hands. Find out if you can and do it.
Frequently asked questions and myths about foot health. Common issues include plantar fasciitis, bunions, ingrown toenails, and fungal infections. Foot pain is not normal. Early care prevents serious problems. Some nerve damage cannot be cured, but treatment eases symptoms. Lastly, fungal toenails are treatable and new therapies restore healthy nails.
So why is it important to have a really good solid orthotic? Imagine having a tire that has a flimsy support. Every single thing above, or what we call everything that's in the superstructure, will be off balance. Why do we recommend custom-made orthotics? Because you want something that's custom for your arch. All of these orthotics, whether we're talking about a sport, whether we're talking about a dress, there is a solution for everybody. There are solutions for pediatrics or for kids as well. So my job is to help you diagnose the problem, and we want to treat the problem. Most of the time though, we are treating the symptom instead of the problem. No. At Flat Shoulder Foot and Ankle Center, we diagnose and treat the problem so that the symptoms will go away. So come on in to be evaluated for a custom-made orthotic arch support so that we can reestablish your foundation and get you back on your feet again. Hey, Dr. Clements here. So today I want to talk about venous disease. Venous is having to do with the vein. And I want to specifically talk about venous insufficiency ulcers and what can be done to prevent them or to treat them effectively. So the artery brings the blood away from the heart. The arteries bring the blood away from the heart, but the vein brings the blood back to the heart. So in order to go back to the heart, the veins are going uphill, or the blood is going uphill through the veins. The veins have valves. The valves keep the blood going up. Ordinarily, what should happen is the valves should close as the blood shoots up. With venous insufficiency, the valves become incompetent, meaning they don't close properly, so the blood shoots back down. So that's why we start to see those, the varicose veins, they start to dilate, they become wider because there's incompetence. So one of the treatments after this has been properly treated is compression hose, which is great. Walking is excellent as well. You want to treat the problem, not the symptom. So with varicose veins, you can develop venous insufficiency. Basically, the valves are not closing in the veins and the blood is pooling or going back down. Because remember, the blood has to go back up to the heart, so it's an uphill battle, right? So what will happen is as the fluid begins to pool in the legs or the lower extremity, it's going to increase the tension in the tissue, which will cause itching initially, like an itching burning sensation, but then it's going to cause ulcers at the site. And it's usually at the end around the ankle or in the leg is where we tend to see these venous insufficiency ulcers. So those need to be treated because they're very painful. In addition, there has to be proper compression, but we have to treat the wound as well. But in order for those to heal, we have to stop the excessive fluid that's building up. So it can be treated 100%, but we have to understand what's causing the problem, treat the problem, and not just the symptom. Hey, Dr. Clements. Today I want to talk about calluses and corns on the feet. Most people don't realize these are caused by imbalances. And what do I mean by an imbalance? So if the arch is too high or if the arch is too low is pronation, too high is supination, it will cause an imbalance. It'll create like a buckling. When the toes are buckling, you're either going to get a corn on top or a callus underneath the bottom. So corns or calluses represent an imbalance, a biomechanical instability. You must first treat that. Once you treat that, you can also cut or remove. When I say you, we would do it professionally. It's called debridement of the lesion. We would debride it down to bring it back to normal, but you have to balance. If you don't balance, it's like the tires. You got to balance, align, and rotate. And if you don't have a proper shoe with a proper arch support, the problem will keep coming back and it can become painful, which can cause either bursitis or what we call metatarsalgia.
The top 5 heel pain mistakes women make. Mistake 1. Wearing the wrong shoes. Mistake 2. Ignoring the pain. Mistake 3. Relying only on stretching. Mistake 4. Self-diagnosing and Googling. Mistake 5. Delaying professional help.
Hey, Dr. Clements here. So I want to read one of the plaques in my office, and it says 12 things to always remember. The first one is the past cannot be changed. Number 2, opinions don't define your reality. Number 3, everybody's journey is different. Number 4, things always get better with time. Number 5, judgments are confessions of character. Number 6, overthinking will lead to sadness. Number 7, happiness is found within. Number 8, positive thoughts create positive things. Number 9, smiles are contagious. Number 10, kindness is free. Number 11, we only fail if we quit. And number 12, what goes around comes around. Motivate yourself. Don't wait for anybody else to be your source of motivation. Go within. You have that power and authority. Make your day magical. Make your life magical. It's your choice.
Did you know? Each human foot contains 26 bones, 33 joints, more than 100 muscles, tendons, and ligaments, plus an intricate network of blood vessels and nerves.
Hey there, Dr. Clements again with your Motivational Minute. So I just want to remind you that every single process happening in your body right now is a miracle for somebody else. What do I mean by that? If you can get up and go urinate or pee, that's a miracle for somebody that is suffering with renal damage, right? Or may need dialysis. If you can have a good bowel movement, that's a miracle for some people with chronic constipation. So pooping is actually a really big deal. So when your body is doing these things, thank it. Thank it. If you can walk and you have 2 feet, that's a miracle for somebody else. So a lot of times we don't see the everyday miracles that are happening in our lives. If you have somebody who loves you, or if you're able to love somebody, that's a miracle. So enjoy the small things because they're really big for others, okay? Hey, Dr. Clements again. So today I want to talk about PAD specifically. So PAD, some of the warning signs are pain in the leg that's brought on by walking, relieved by rest, pain in the leg that's due to very poor circulation. It could be leg or feet, a poorly healing wound in the lower extremity, the ankle, the legs, also the feet, injury to the lower limb or foot involving blood vessels or discoloration of the toes and feet. So these are some of the signs. So a lot of times when a patient is having pain, especially arterial pain, which is what we're talking about with PAD, which is peripheral arterial disease, we're talking about lack of oxygen. So if there's something that's decreasing the blood flow, that something could be plaque, it could be a blood clot, whatever the cause is, we've got to treat that root cause. If we don't treat the cause, then the symptoms, which is a pain, leads to gangrene and amputation. Hey, Dr. Clements again. So I want to talk to you today about gout. Gout is a type of arthritis, and it typically will impact the big toe joint of the lower extremity. It can impact any joint because it's a type of arthritis. It can impact the ankle, the knees. Typically in the upper extremity, we're going to see those big golf balls at the elbow. So it can impact the elbows. It can impact any of the joints. I've noticed mostly in this joint, but it can be any of them. So if you're having pain, it's usually excruciating pain that wakes you up in the morning. wakes you up at night or keeps you from going to sleep, it might be a gouty attack. And again, gout has a liking, or what we call a predilection, for that big toe joint. And when I tell you, this is the only time grown men will come into my office in excruciating pain, crying sometimes, because that pain is intense. And what is happening, there are uric acids that the body is not releasing. So when protein is broken down, one of the end products is uric acid, right? So uric acid is usually, it just goes out through the urine, right? But if it's accumulating, meaning it's not going out or too much is being broken down, or the end product of the uric acid is lodging in the joint, or the uric acid itself is lodging in the joint, then it's going to cause pain and inflammation. Icy hot is the best way to describe it, because these are the uric acid crystals, and the crystals are actually in the joint, and it creates a huge inflammatory, so the flaming response. So on average, we're going to see red hot swollen, and nothing, the bed sheets will hurt. It's very painful. Most patients will come in on crutches, or they can't put any weight on it. Very successful to treat it. I usually do a trigger point injection of an anesthetic. And I use two types of anesthesia, one that works immediately, one that's a little longer acting. And the purpose of the anesthesia is to wash the uric acid out of the joint. And when I do that, patients walk out, they hop in, literally they limp in, can't put any weight on it, and they will walk out. And it depends on the severity of their gouty flare-up. So sometimes if their pain level is a 10 out of 10, I'm going to put them in a soft cast, and I'm going to put them in a boot. And I will also prescribe anti-gout medication. Sometimes I do an anti-inflammatory as well. And we also recommend changes to the diet for a patient, because diet is part of it. Lifestyle is one of the number one things that will cause gouty flare-ups. And they call gout the rich man disease. And the reason for that is because it's the foods that are really rich. It's red wine, beer, it's steaks, it's shrimp, it's lobster, it's all the good stuff. Dehydration can also bring on gouty attacks as well. And most of the time when I see men, it's usually because they're outside mowing the lawn, they're drinking a beer, and they're dehydrated, they don't even know it. High cholesterol can also be something that can be part of what's going on to bring a patient in with a gouty flare-up. And then the other thing too is that there are several different treatments that can be done. So an acute flare-up is when the pain it just starts out of nowhere, versus chronic gout. So there are different types. So we have to know how to treat it appropriately. So with gout, you're either overproducing uric acid or you're under excreting, meaning you're not getting rid of it. So there are other ways that we can diagnose it as well. Very easy to diagnose, very easy to treat. It can be treated successfully. So don't sit around on gouty flare-ups, because gout can actually knock the kidneys out, leading to dialysis. So it's something that definitely needs to be treated successfully and made a priority, because not only can it impact one joint, gout is also called a migratory arthritis. So it migrates from one joint to the other joint. So patients will come in and their initial pain may be in the left big toe, and then 2 weeks or 2 months later, it may be in the right ankle. So it will migrate from joint to joint. So our job, meaning my job and the patient's job, is to treat the problem, not the symptom only, but we got to treat the symptom because it's excruciating. So it's important to treat the overall cause so that we can decrease the recurrence of the symptoms. Okay? Hopefully that helps. And may you never get a gouty flare-up, because it is a wicked pain. But it's one that I love to treat because, again, I've been doing this successfully for over 23 years. And it is such a joy when a patient, literally, they just come in, they're just hobbling, hardly can make it, they're miserable. And we will excuse them because most of the time they're just going to be like
irritated and just not a pleasant person. But then when the pain level drops from 10 out of 10 to like a 4 or a 5, and they get out of that psychotic pain cycle, then they can think again, and it's like you can see the burden lift. So it's actually a pleasure to treat these things. But again, always get a proper diagnosis so you can get a proper treatment. Okay? Bye.
I love treating gout. There is nothing like the satisfaction of a patient limping in and walking out. I tell you, I do this every day. 23 years I've been doing this, and oh my gosh, here comes another one. Gotta go. So, if you have a red hot swollen foot or ankle, it might be a gouty flare-up. If the bed sheets hurt, it might be a gouty flare-up. If the pain moves from joint to joint, it might be a gouty flare-up. So do not sit on this.
Your feet carry you 100,000 miles in a lifetime. Check them daily, wear the right shoes, trim nails safely. Healthy feet, healthy you.
Hey, Dr. Clements here again. So today I'd like to share some rules that are very vital for us as human beings. So the first rule is the golden rule. Everybody knows the golden rule. It says, do unto others as you would have others do unto you, right? Perfect. Do that. However, the platinum rule says, do unto others as they would have done unto them. Well, why is that important? It's important because whatever a person desires or whatever makes them happy, their love language, that's what is valuable. So for instance, if I do unto others as I would have done unto me, if I'm going to give my husband flowers, yeah, that's going to make me feel good, but he'll be okay with it. He'll be like, oh, thank you. But that's not his love language, because, flowers, he's like neither near here or there with that. So give people what they desire, not so much what makes you happy when you give it to them. Listen to that, what I just said. So today I was talking with a patient and I came up with the Clements rule. Well, what's the Clements rule? The platinum again is do unto others as they would have done unto them, right? Well, the Clements rule is do unto you as you do to others. Now, I want the positive spin of this. It's very important that you stick with the positive end of it, because when you fly in an airplane, they tell you in the event of an emergency, put your own daggone oxygen on first. Why is this important? Because I find that a lot of times we spend so much time trying to help other people that we go down in the process of helping them because we did not secure ourselves first. So this is not saying be selfish, but this is saying be proactive with your own self-care. So the Clements rule says, do unto you first that which you would do unto others. If you want others to be happy, you allow yourself to be happy. If you want to be rich or help others be rich, then you learn how to be rich. If you want to have wonderful, loving, supportive relationships with other people, you learn how to have wonderful, loving, supportive relationships for yourself. So it's important because I find a lot of times we as human beings, we want to help other people. At our core level, most humans tend to be really good people. Now, here's the drawback with that is that when you tend to always want to give, always want to help other people, it's a wonderful thing. And I did that for years, almost to the point where I was so depleted, I was empty. So what I've learned over my years is I have to fill me up first. So I am purposeful, I'm intentional. I take the time to fill my cup first. What do? I put everything that I need, whatever support. I take time for myself. I listen to my body. I teach people how I want them to treat me. Very important, because if not, you slide into a reactionary life. Ain't nobody got time for that. You want to be proactive with your life as much as possible. And you want to be in the driver's seat. So how do you get in the driver's seat of your life? Practice the Clements rule. The Clements rule says, I'm going to fill me up first. Then I give out of my overflow. So when I'm done giving at the end of seeing patients for the day, I don't feel depleted. I don't. I feel energized because I came with 100% intention. I know my skill. As a podiatrist, I've been practicing for over 23 years now. I've been a podiatrist since 2000. I'm at a level of unconscious competence at this point, and I don't say it arrogantly. I say it with glory to God for the excellence that I can bring to the table to be able to diagnose and treat and literally get patients back on their feet every day. So I'm showing up 100%, but in order for me to do that, I also see that I'm a vessel through which God works. And I see myself as God's hands and feet extended. So when I'm doing whatever I'm doing, I literally am plugged into my source, and I'm calling that source God. Whatever you call that source, right? You got to plug in. So sometimes it takes us practicing being unplugged from social media, being unplugged from the noise of the world, being unplugged and plugging into whatever you define as your source. So take this as your rule, put it in your toolbox, so to speak, and be proactive with it. You can have a flat tire, but if you have a spare tire ready to go, that flat doesn't have to keep you on the side of the road. Have this as a piece of your peace of mind. When you fill yourself up to overflow, whatever you're doing, make sure you have your proper intention set for the day. Make sure you are a person of integrity. You speak, your word mean what they mean. All of these things are ways to keep you in a place of overflow and overfill. So I fill me up first, and a lot of times patients will ask, well, how come you always seem bubbly? You always seem to have a way of helping me feel better. When I leave your presence, I always feel good. I feel warm. I feel hopeful. Well, that's not by accident. It's because I'm very intentional that that's what I'm going to do. But I do it because I realize that I have a tremendous gift, and I'm going to use my gift. And my gift is to help people heal from the inside out. So whatever your gift is, be a person of integrity. Make sure you are a person of self-integrity. Fill yourself up first. Don't lie to yourself. Make sure you're speaking. Make sure you're using your words to create life and not death. And make sure your actions, how you think, how you eat, how you move, are all aligned with your belief system. If your belief system is not what it should be, you may need to change that as well. Take care. Bye. Hey, Dr. Clements here. So today I'm going to talk about fractures, and I want to talk about the main fractures that we typically see in our practices, or at least I should say I see in my practice. And normally stress fractures, they happen, but not as frequently. But a stress fracture is happening on a bone that is thinning, or what we call osteoporotic, or it could be osteopenia. And penia is a thinning of the bone, right? So what happens is walking becomes repetitive micro trauma, and that can cause the bone to fracture. So stress fractures, we see a regular fracture. Typically, the bone is normal, so it's not demineralized, but it's caused by trauma. And that can be another source of the fracture as well. And the third one is not often seen, but I see it a lot because I treat a high diabetic population, is a Charcot foot or Charcot fracture. Now, with Charcot, there is what we call a demineralization of the bone as well. So as a result of that, the bone starts to have multiple fractures. And as that happens, depending on where the fractures are, so say if the fractures are here in the midfoot and the arch begins to fall, it's going to start to have a break right here. As a result, the foot is actually going to become inverted, and these patients are actually walking on the middle of the arch. Now, what's the problem with that? The middle of the arch has no fat. It has no fatty absorption as we do like up here under the ball or in the heel. So as a result, these patients tend to ulcerate. So when they have an ulcer, which is a break in the skin, those easily become infected. So Charcot is another one that's caused by, it's not just diabetes, there are other things that can cause it as well, but usually there is some damage to the nerve, which is peripheral neuropathy, that will be at the root cause of Charcot. So that's why we always recommend our diabetic patients know what their A1C is, because the A1C that's elevated, anybody that's 8 or greater is going to have an increased risk of Charcot. If you've been at 14, Charcot is already knocking on your door, but there's still things that can be done to help to stabilize the foot. Sometimes surgery is necessary. But it depends on the stage of Charcot. If it's an acute Charcot, we're not touching that foot with anything. All we're doing is stabilizing. So again, understanding what is going on is vital, but also understanding what can be done and when it needs to be done is also equally vital. One of the things that is pretty standard is that when we're treating fractures, it's typically about 6 to 8 weeks in terms of treatment. So we're stabilizing the area, making sure that the fracture fragments, meaning that the two pieces of bone, that they're not terribly separated. So if the two pieces of bone are greater than 2 millimeters separated, or what we call displaced, then that usually needs surgery to put the two bones back together. And sometimes we'll use pins, screws, plates. It's literally like a hardware, like you're in hardware school. But yeah, we use all those hardwares to hold the bone fragments together. Sometimes treatment is a hard cast. Sometimes it's a splint. Initially, it's a splint because of the amount of swelling that's around the area, but we've got to stabilize it, but we expect more swelling. So initially, after a traumatic fracture, you're going to go in a posterior splint. And then after that, either a hard or soft cast in some type of a boot, but that's going to be about 6 to 8 weeks for healing. Now, if the fracture is in the foot itself, normally, if the fracture is in the long bones called the metatarsals, we may be able to get away with you in a smaller boot for a little shorter period of time, but we'll do x-rays every 2 to 4 weeks to make sure that the bones are healing well. If the fracture is in the toes or the phalanges, so these I can usually get you pain-free in a surgical shoe and keep you stabilized while the bone is healing. So it depends on the level of the fracture, what type of support in terms of surgical shoe or walking boot or no pressure at all. If it's an ankle fracture, definitely most of the time we're going to see it on the lateral aspect of the joint. Sometimes we'll see it medially, sometimes it'll be both. So again, depending on the level of the fracture, the treatment is going to be a little different, but the root cause needs to be evaluated. We also need to look at the patient to see, are they young? Do they have good bone stock? Do they have good blood supply? All of these things are valuable to understand how to properly treat a fracture. So hope this helps. And if you ever have any questions, always reach out. Let us know. Bye.
Keep on trying me, feel it quietly, trying to silence me, yeah. Anxiety
Dr. Clements. So today I want to give you a brief review of the foot and where most of the problems I'm treating are coming from, right? So the first, one of the biggest ones I treat every day is called plantar fasciitis. So what happens is the Achilles tendon comes down and it inserts into the back of the heel, and it sends fibers underneath that become the plantar fascia. And the plantar fascia lays like this, right? So when you're walking and you're actually, the arch is flattening, we tend to see a pull or a tug right there, and you get small tears in the fiber, and that can be the source of your problem. So plantar fasciitis could be the problem. Achilles tendonitis, where the Achilles inserts here. Another one I treat frequently is a neuroma, which is a pinched nerve as it's going between the bones, right here, right here. So if your foot is swollen, or if you're wearing shoes that are too high, because when your shoe is high, you're actually causing the intermetatarsal ligament to pull together, and it's squeezing the nerve, and that can pinch the nerve. That symptom is usually numbness, tingling, burning in the balls right under here, and most patients will usually feel it's like a pebble-like sensation. They feel as if they're walking on a pebble, or there's something in there, right? So that's another one. Another one that I frequently treat is a tendonitis. So this is the middle of the arch. So as the arch comes underneath right here, there's a tendon called the posterior tibial tendon. It attaches right here, and its job is to pull the arch back up, but it becomes overworked sometime, and it's like, I'm not doing this anymore. So what we've got to do is, you always want to find out what the root cause is and treat that. Another frequent one that I treat is because people are lacing their shoe too tight. And when you're lacing too tight, if you have little bone spurs, you see right here? That's a little bone spur right here. So if you're lacing the shoe tight, and if you're a little swollen, you're actually gonna impinge the nerve, and you're gonna create a neuritis, which is an inflammation of the nerve. So on the top of the foot is where the highest pain point will be, but the pain will shoot distally, meaning to the toes, or the pain can shoot up as well. Usually there's going to be a little bit of swelling, not a tremendous amount, and some redness. Now, the differential diagnosis in this area is called a ganglion. So a ganglion is ordinarily caused by trauma as well. So something could have fallen on the foot. You could have been doing a lot of walking. Again, walking can become repetitive micro trauma, and it will cause, there's a little protective layer of like a little fiber that's right on top of the joints right here, right? So what happens is that area starts to become weakened, and it starts to herniate or out pocket. And when that happens, the ganglion, the fluid from inside starts to push out, and there's usually a tenting, and it looks like a little ball. And it can be very excruciating, because the same thing, we have superficial nerves on top right here, and when those superficial nerves are pinched or any type of injury to them, they're going to start to signal pain, and that can cause pain shooting to the toes, or it can cause pain shooting up. So again, tons of stuff that can happen with these little bitty feet. And the funny thing is, look at how big these bodies are. Yes, beautiful, voluptuous, I know. But guess what though? The bigger you are, the more repetitive trauma you're doing to these little bitty feet. So if you're big, you're beautiful, even if you're skinny and beautiful, I don't care. The point I'm making is you need to have the proper shoes. You have to have the proper support, because when you don't, your feet are going to give you signals. And what are the signals? Numbness, tingling, burning, swelling, lack of motion. You may have cramping. All of these are warning signs that we get from our body telling us something is out of order. So yes, if you have feet, you can have problems, but you don't have to. So again, at the first sign, first of all, you want to prevent the problem, but at the first sign of any type of numbness, tingling, burning pain, you need to be in somebody's chair that plays at the problem that you have, okay? Hopefully that helps. Bye.
flag reminders. Don't ignore persistent foot pain, it's a warning sign. If a blister doesn't heal, get it checked. Sudden swelling could mean an injury or circulation issue. Discoloration in toes may signal poor blood flow.
Hi, Dr. Suzette Clements here, board certified podiatrist, author, and transformational coach. And it is truly my honor to be one of the featured speakers in this year's Black Health Initiative Conference happening November 14th and 15th. Now, this inaugural Health and Healing Conference is not just an event, it's a movement towards total wellness in our community. So, I'll be speaking on the topic of your feet as your foundation, which is a near and dear topic for me. Now, why is this so important? Because when the foundation is off, it throws everything in the superstructure off. But the opposite is true. When you strengthen the foundation, everything comes back into alignment. You move smoother and the foundation is better. So I want to see you there. I look forward to seeing you there. And I pray that this conference will not just be motivational, but it's going to be transformational as well. So head on over to theblackhealthinitiative.com and secure your spot. And trust me, this is one experience you don't want to miss. I've got them moves. I get a good feeling. I got it. Yeah. He was a boy, she was a girl. You don't know you're beautiful. So sister, we don't even have to try. It's always a good time. I just want to say thank you for every single person that prayed for Jamaica during this extremely difficult season. As a native Jamaican, I cannot say enough how much we thank you for your prayers. Continue to pray. It's very important to every single person right now. We will share ways you can donate, you can help, but the best thing you can do is continue to pray for a proper restoration of our beautiful country. Thank you so much. We highly appreciate you. Dr. Clements, I just want to say thank you for every single person that prayed for Jamaica during this extremely difficult season. As a native Jamaican, I cannot say enough how much we thank you for your prayers. Continue to pray. It's very important to every single person right now. We will share ways you can donate, you can help, but the best thing you can do is continue to pray for a proper restoration of our beautiful country. Thank you so much. We highly appreciate you. Dr. Clements, I just want to say thank you for every single person that prayed for Jamaica during this extremely difficult season. As a native Jamaican, I cannot say enough how much we thank you for your prayers. Continue to pray. It's very important to every single person right now. We will share ways you can donate, you can help, but the best thing you can do is continue to pray for a proper restoration of our beautiful country. Thank you so much. We highly appreciate you.
Hey, I want to talk to you about a myth. People sometimes feel that if they don't invoke their constitutional rights, that somehow will put them in the police officer's good graces. That's absolutely false. If an officer asks to search your car and you say yes, they're going to search your car. They're not going to say, no, I don't want to search it because you said yes. If you say no, they'll have to get a warrant or have some legal basis to search your vehicle. So don't consent to it. If they say, will you do this for me? And you say, yeah, I'll get out the car and do some sobriety tests. Why would you do that? They're investigating you. I felt if I didn't say that, I was going to go to jail. Well, what you've done now is you've helped them to gather evidence that they're going to use to convict you. So you will go to jail either way. But the question is what happens down the line. And because you thought that by agreeing with the officer, it was going to benefit you, you now learn that it hurt your case. Stand on your constitutional rights. I want to talk to you all about appeals. A lot of people tend to think that they're going to go to trial, and then if they don't get the result they wanted, then they're going to do an appeal. An appeal is not a second trial. They're not going and looking at it again like that. What they're doing is they're looking to find out if there were any mistakes made at the first trial that were so bad that they warrant a new trial. That's the basic concept of an appeal. So if you're thinking, I can go to trial, then I'll just take an appeal. No, they're looking to also affirm whatever happened at the trial level. So if you lost in a civil case, they're looking to affirm that. If you lost in a criminal case, they're looking to affirm your conviction. They're not looking at the evidence of brand new. They're looking at what was already done. They're basically critiquing your trial. So understand that process, which is why when you go to trial, you better put your best foot forward and don't think you got a second bite at the apple, because you really don't. You know, one of the things I get tired of dealing with, I deal with it. Parents, when their kids are being investigated, they're like, well, I took them to talk to the police. And I'm like, what are you thinking about? What are you doing? These people want to arrest your kid. And you're going to sit there and be like, well, I wanted to go and cooperate and be friendly. This ain't the time to be friendly. This is the time to be adversarial. Get you a lawyer. Say no. All this cooperating. You're going to cooperate your child into a jail sentence. Hire you a lawyer. Tell them, no, we're not coming to see you. That's what you're supposed to do. But, you know, can't teach.